All right, so this is the large torso model. There's a lot of blood vessels here. I'll get most of the ones on our list, if not all. Here we have an artery, that's occipital. And then this vein here is posterior auricular. And you can follow that posterior auricular down to the external jugular, all the way down to subclavian vein. And then running parallel to external jugular would be internal. And then here's the other internal jugular. And there's really, we can go up here and see superficial temporal vein and artery. We can see some branches coming off the facial artery, but not the beginning of it. It's a bit deeper. Those would be better visualized on the skull model. If we go back to subclavian here, we've got one of the first branches that come off before subclavian becomes axillary, and that is cephalic. So you can see it's really superficial. Going backwards, subclavian, all the way to here where we have that internal jugular. So blood coming down internal jugular, blood coming down subclavian, merge here where we form the brachiocephalic vein. This would be the left one, and that would be the right. And then the left and right brachiocephalic veins come together and empty into superior vena cava. All right, so here's the right subclavian artery and vein. The artery running parallel to internal jugular is common carotid. So here's right common carotid, which along with right subclavian come off of the brachiocephalic trunk right here. And then the next branch over, left common carotid artery, and then the third branch, left subclavian. And then the aortic arch turns, descends, so this would be descending thoracic aorta. And then the branches coming off, those would be posterior intercostal. And then right here next to the posterior intercostal artery, we can see a posterior intercostal vein. Those veins empty into hemiazygos, which we can see coming up here. And then right here is one of the points where hemiazygos would empty into azygos, which we can't see. It would be behind these structures here. Here we can see some branches off of the pulmonary artery, right pulmonary artery, and right pulmonary vein. As we go over to the right side, here you can see axillary. And then axillary is going to send off a branch that remains a little bit superficial, and that's basilic. And then axillary becomes brachial, which runs deep. So we can't see that, it's under the musculature here. Moving on to the abdominal region, celiac trunk, left gastric artery, splenic artery, common hepatic artery. And then here we've got superior mesenteric artery. And down here would be inferior mesenteric artery. And then up here would be the right and left gonadal arteries. And you can follow the left down. And then running alongside the left gonadal arteries, left gonadal vein, that blood's coming up into the left renal vein here. And then there's a branch coming from the left adrenal gland or suprarenal gland. So that's a suprarenal vein. And then left renal and right renal veins empty into inferior vena cava. Over here is the right renal artery. As we come down to the bottom of aorta and inferior vena cava, they split into common iliacs. So this would be left common iliac artery and vein. And then when you can find the internal iliac vein and artery, you know that what is left of the common iliac is now external. Right? So common starts here, ends here, splits into internal and external iliac. So external iliac artery and vein pass through the inguinal canal, emerge on the other side as femoral artery and vein. The femoral artery and vein can be seen together on this side. Follow the femoral artery down, gives off a branch here that runs deep. That is deep femoral artery. And then over here, we have great saphenous, which is going to be a branch off of femoral. That's great saphenous there. And up here, this would be right gonadal vein, emptying directly into inferior vena cava. And I think the last thing would be over here. So here we have anterior intercostal artery and vein. And the anterior intercostal arteries come off of the internal thoracic artery. And that's it.
Nothing down there?
Mm-mm.